Hi, Tiara. I'm Tara. I'm going to be your nurse practitioner today. Today, we're going to assess your musculoskeletal system and your nervous system. Is that okay? This includes me testing your strength, your cranial nerves, and your range of motion. And I'm going to sanitize my hand before we get started. Do you have any joint pain right now?
No.
No. Any muscle pain or tenderness?
No.
Have you ever had any joint surgeries?
No.
Okay. First thing we're going to do, I'm going to have you stand, and I'm just going to assess your musculoskeletal system. Yep, you can stand that way. I'm just going to look at you from the back and then the front, make sure everything is symmetrical. Your shoulders are symmetrical. Your scapula is symmetrical bilaterally. Arms are the same length bilaterally. Then I'm going to, so when I'm assessing you, I'm looking for symmetry and everything is symmetrical. Then I'm going to inspect your spine. Just feel here. I'm checking for any curvature of the spine, no lordosis or kyphosis seen. Have you bend over? I'll check your spine again. Everything is midline, no bumps or swelling noted. Your hips are symmetrically bilaterally. You can stand up. I didn't feel any swelling or anything like that. You can have a seat. Now I'm going to palpate your joints, and you let me know if you have any tenderness or pain. So I'm going to palpate your hand and your wrist, your fingers. I'm checking for any nodules or swelling, which I don't see any. Everything feels normal. No swelling or nodules noted. No tenderness. No joint pain.
No.
I'm also going to palpate here. Now I'm checking for crepitus or any masses or bumps or lumps. I don't feel anything. Clavicles are symmetrical. And I'll assess your thyroid and your trachea. Trachea is midline. Okay, next thing I'm going to do is test your range of motion. So I'm going to have you straighten your arms up, reach them up over your head. Good. And then you can put them out to your side. Make big circles for me. Forward. Big circles backwards. Any pain when you do that?
No.
Okay, good. I am going to hold your arms straight out for me. Don't let me push them down. Good. Now you try to pull them down. Good. Take my 2 fingers. I want you to pull. Good. Push. Good. Hold your elbows out like this. Good. And don't let me push down. Perfect. Then I'm going to assess your TMJ joint. I'm going to have you open and close your mouth. Good. Any pain when you do that?
No.
Okay, good. I didn't feel any masses or nodules when she did that. I checked your spine already. Your hips, good. So I'm going to put my hand on your knee. I want you to try to raise your knee. Lift it up. Good. Do that one. Good. And extend your legs out. Don't let me push them down. Good. Try to hold them up. Well, let's do one at a time. Okay. Do your other ones. Good. Okay. Now I want you to point your toes to your head. Good. Try to push down like you're pushing a gas pedal. Okay. I'm also gonna just check your ankles and feet for any swelling. I don't see any swelling. No ankle pain or anything like that.
No.
Okay. We're gonna leave these off for the next part of our exam. And I notice you do have all 10 toes. You can wiggle your toes. Good. Let me see you do your fingers. Open, close. Fist. Yeah, there you go. All right, I'm going to take your hand. I want you to close your eyes and you tell me, I'm going to draw a letter on your palm. You tell me what letter that is.
7.
Yes, a letter. Sorry.
T.
Yes. Okay, keep your eyes closed. I'm going to touch you in different parts of your body and you let me know if you can feel it, okay?
Yes. 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 Yes.
Okay. So I'm going to do that again. You let me know where I'm touching. Just say where.
My arm. My knee. My foot. My left arm. My cheek.
Okay. I'm going to just test your reflexes. Go ahead and scoot back for me a little bit. There you go. I'm going to test your plantar reflexes. Okay. Relax your leg for me. Go get in. Okay. Now I'm going to test your brachioradialis reflex. Okay. I'm going to do that on the other side. Just relax your arm. Now I'm going to test your ankles for clonus. Like I said, you don't have any swelling. No clonus in that foot. No clonus in that one. And that concludes the musculoskeletal part. So now I'm going to do your cranial nerve assessment. So the first thing I'm going to have you do is close your eyes and let me know if you can smell this. What does it smell like?
Like coconuts.
Yes. Next thing I'm going to do, I'm going to check your optic nerve. This is your cranial nerve 2. So you can open your eyes. And I'm going to cover one eye and you let me know how many fingers I have got up.
2. 2. 1.
And can you see me?
Yes.
Okay. Now I'm going to do the other side.
2. 2. 2. 3.
Yep. And can you see me?
Yes.
Okay. Now I'm going to use my ophthalmoscope to check your accommodation. So just look straight ahead. Pupils are round and reactive to light. Accommodation is normal. Both your eyes constrict when I put the light on them. Pupil size was 2. So next we're going to assess the cranial nerve 4. This is your trochlear cranial nerve. So with your eyes, I'm going to have you look up, look down, and look at your nose. Okay. And then I'm going to have you look left to right. This is trochlear nerve, or this cranial nerve 6, abductus. I'm going to have you look right to left with your eyes. Good. Cranial nerve 5 is the trigeminal nerve. So when I assessed your mandibular joint earlier, open your mouth up and down. No pain with that? Okay. And then I'm going to test your cranial nerve 7. This is your facial nerve. I'm going to have you wrinkle your forehead. Okay, squint your eyes. Good. And then push your lips together like you're kissing. Good. Then I want you to say your vowels.
A-E-I-O-U.
Yes, and do a big smile for me. Good. Okay. So we're going to test cranial nerve 8. This is the acoustic nerve. And you let me know which sound you can hear louder, 1 or 2. Okay. 1 or or 2?
1,
1 or 2?
1.
Good. Now I'm gonna check equilibrium. Equilibrium. You tell me if you can feel it equally all over. Okay.
Yes.
Good. We're gonna check cranial nerves 10. Or yeah, 10 and 11. 9 and 10. 9 is your glossopharyngeal. That's your gag reflex. I'm not gonna do her because she's super sensitive, but I am gonna check your vagus nerve, cranial nerve 10. I'm gonna have you open wide, say ah, stick your tongue out. And I can see your uvula, it is midline. Then I'm gonna have you shrug your shoulders, move them up and down. Good. And that's your cranial nerve 11. Then turn your head right to left. Any pain when you do that? No. Okay, good. And then the last one we're gonna check is your hypoglossal nerve, cranial nerve 12. Have you stick your tongue out, move it side to side. Okay, perfect. All right. So now I'm gonna have you, we're gonna do what we call the heel to toe touch. You're gonna take your heel on your right foot and put it on your left knee and go all the way down to your toes. Yep. Do your other one. Heel all the way down to your toe. Good. Now I want you to do the same with your arms. Take your right arm, put it on your left shoulder, go all the way down to the tips of your fingers, and then do the same on the other side. Good. All right, I'm gonna have you stand up. I'm gonna do the Romberger's test. Just stand straight up with your eyes closed. Just checking for equilibrium. You don't feel any dizziness or ringing in your ears or anything like that? No. Okay. And now I'm going to just observe your gait. I want you to come back here. You're going to do a couple of walks for me. I just want you to walk normal first. Good. And then on your way back, I want you to do walk on your heels. Good. Turn around. You're going to walk again on your tiptoes. Good. No pain or anything when you do that?
No.
And the last on your way back, you're going to do heel to toe. Okay, good. Go ahead. I'll have you sit. Now I'm going to test your sensory function. And you're going to let me know if you can feel this, okay? Feel that?
Yes.
Does it feel sharp or?
Sharp.
Okay, good. Tell me where you feel sharp.
Yes, sharp. Sharp. Sharp.
Okay. Now I'm going to do what we call light touch. So let me know if you can feel where I'm touching you.
Yes. 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 Yeah. Yes. Yes. Yes.
Okay. Now I'm going to have you keep your eyes closed and open your hand. I'm going to place an object in your hand and I want you to grab the object and tell me what it is.
Paperclip.
Correct. I'll take that. Now I'm going to do assess the 2-point discrimination. Let me know if you feel me poking you in 2 places or one spot.
2. 2. 1. 1.
Okay. All right. Everything checks out normal. That concludes your assessment. Thank you for your time.
Thank you.
Bye.